How are you doing? It's a question that needs to be asked now more than ever. Coronavirus has challenged our health in ways we never could have imagined.
I've been downplaying pain for over a month, mentally.
Now the answer we've been waiting for is here. Kind of. Even though there is a vaccine, there are still so many questions like, how do we get it?
We're the most isolated hospital in the whole state.
This week, we look at the state of healthcare in America and what can get us closer to having those questions answered. This is The Race. Welcome to The Race. I'm Chris Stewart. Distributing the coronavirus vaccine to millions of people is proving to be one of the biggest challenges our country has faced in this pandemic. And for rural communities like Alpena, Michigan, an isolated city hours from a major metropolitan area, that challenge can be even greater. This pandemic is a journey.
Well, we have a precious cargo, so this vaccine is very temperature sensitive.
Brian Cross is making some of its most important trips.
We got to make sure it maintains a very specific temperature. Can't be shaken at all.
Riding shotgun in this pharmacist's car are 500 doses of Pfizer's COVID vaccine.
We kind of treat it like a baby here in the front seat and hand deliver it to each of our pharmacies.
He works for Mid-Michigan Health. The company runs a handful of hospitals in central and northern Michigan. Today, some of these vaccines are headed to the most isolated hospital in the state, in Alpena.
We're pretty fortunate in Michigan. We have a map, right at our fingertips, right? So when you look at Michigan, we're way up here.
While geography may make this area feel far away, when it comes to vaccinating, it is not behind.
Some of the first in the country to receive their second dose.
This week, hundreds of healthcare workers are receiving their final dose of the vaccine, 3 weeks after receiving their first. Like ICU nurse Katrina Farley.
My hardest part is sitting with someone when they're passing, without family there.
Do you know how many times you've had to do that?
Many.
Within the next couple of weeks, the vaccine is expected to give her 95% immunity to coronavirus.
If this is the little bit I can do to protect the rest of the people, that's what I want to do.
When handling the vaccine, the clock is always ticking. Mid-Michigan Health has one special freezer that can keep the vaccine at the desired 94 degrees below zero. They provided us this video of the vaccine being put into it.
In the freezer, it's good for 6 months. And then once it's out of the freezer in a refrigerator, it's good for 5 days.
That freezer is located about 3 hours south of Alpena. So it's up to people like Brian Cross to drive the doses to hospitals to make sure none are wasted.
It's very time sensitive, so we have to make these trips a little more thoughtful so that we don't waste any of the vaccine.
There are concerns rural communities will fall behind in vaccinating. Some don't have that special freezer like Mid-Michigan Health.
If we were on our own, a small rural hospital in northern Michigan, it would be very difficult for us to probably navigate this whole process.
Dr. Bates says they're now vaccinating patients who are at a higher risk for coronavirus complications like those over the age of 65. He's seen the power of these little vials the world has been waiting for.
One of my favorite stories is one of our nurses here wanted her picture taken when she was getting her vaccine, and she said, I want to send this to my mother, my family, because this is telling them that next year is going to be different. And that was good. That was really good, powerful.
He's talking about ICU nurse Katrina Farley, who hasn't seen her mom in a year.
We're planning a couple weeks from now. I want to make sure we're 100%. And then I'll get together with her and do Christmas.
She says the vaccine will help her continue to care for those suffering from the virus. Work she'll continue until the journey of the pandemic is done.
There's a light at the end of the tunnel, and we're going to beat COVID. We are. It's just going to be time. It's going to take time.
Millions of people who contracted coronavirus in a 1-2 punch have also ended up with expensive and unexpected medical bills. Chris Conte is with a woman who had hers forgiven.
They wait in line for hours. Across the country, COVID testing sites have become the place Americans are turning to find out if they are sick. And while most are never charged for a trip like this, others have been hit with an unwelcome surprise.
I mean, it was shocking, right?
Back in May, Lori Delgado Witten opened her mail to find a bill she never expected, totaling more than $3,000 for one single COVID test. A test that under federal guidelines was supposed to be free.
I felt like they were ripping people off, and they had sort of the perfect way of doing it.
Lori quickly learned that she'd be the only one advocating to fix this mistake. She spent hours on the phone with the hospital and her insurance company, and she did it for the thousands of other Americans who are being tested every day and receiving surprise bills.
I was always the one sort of taking the lead to move it forward. The insurance company wasn't contacting me back. The hospital wasn't contacting me back. You know, any kind of follow-up that was necessary, I had to do.
This is a real problem.
Michelle Johnson is a healthcare advocate. Her worry is that stories like Lori's might deter others from getting a COVID test at a time when the virus is raging.
If we want people to get tested and we're saying that it's free, it has to be free.
Speak up. The only way that wrongs can be righted is if we call people to accountability.
Nearly 8 months after first receiving that bill, Lori is finally free of any financial obligations. She even went so far as to report the issue to the Texas Attorney General where she lives. They are investigating dozens of other similar billing problems.
It really was just about what's just and right. And at times I felt like I was constantly hitting my head against a wall, that nobody seemed to care that this was happening.
A warning to other Americans waiting in line to make sure this doesn't happen to them. I'm Chris Conte.
Surprise medical bills could soon be things of the past. Congress is taking action and signaling it could do more. People get unexpected medical bills most commonly after going to the ER or being admitted to an in-network hospital. Lawmakers on all sides of the aisle agree the practice is unacceptable and passed legislation to address the issue as part of the December COVID relief bill. The main thing this legislation does is limits how much people can be billed for out-of-network care to an amount based on the person's in-network costs. All spending will count toward their deductible. The law will also require providers to give people an out-of-network cost estimate in advance, limit how much air ambulance companies can bill people, and start a medical debt relief program for the uninsured. The changes take effect first thing next year. Lawmakers are already researching their next round of medical billing laws.
My name's Mark. Served in the Navy 3 years.
They served our country.
Kuwait and a few other places.
Now some veterans are living on the street. The serious health issues homeless veterans are facing.
I need to go have in and out stuff, but during this epidemic, they're not going to do that.
When the race continues.